real excited about today's Lunch and Learn because today we have special guests who have consented to join us in our monthly Lunch and Learn. Today, we're talking about something that I pray we all get something out of. When I say all, I'm including myself. And of course, my husband who's here with us, Bishop William Young, he's here to join us today as well. But today we're talking about it's a family affair, health and safety. We're talking about it as a family affair. And I think we'll get a lot of hints and clues today as to how we can deal with the questions that are coming in from our family concerning vaccinations. And we'll talk a little bit about the benefits and the risk. And we've got some awfully wonderful professionals with us. I want to start off by introducing our panel, and then I'll shoot it over to our beginner, and our beginner will keep passing it off. But on our panel today, we have Dr. Priscilla Nellum Davis, a Memphian, of course, and Dr. Davis, she received her PhD in communicative disorders from the State University of New York at Buffalo. She retired from the University of Alabama in Tuscaloosa, Alabama, and is currently a professor emerita at the University of Alabama. She brings expertise in communicative disorders such as child language and speech development. We are so happy to welcome to our panel Dr. Davis. We also welcome to our panel Dr. Ted Lyons. Dr. Lyons, I'm proud to say, is an ordained minister who received the Doctor of Pharmacy degree from the University of Tennessee College of Pharmacy. He and his wife, Dr. Marcia Lyons, own Shot RX. And let me make this known, they are the only African-American vaccination clinic in Memphis, Tennessee. Dr. Lyons has been a champion of pharmacists and immunization specialist for almost 20 years. He served as the clinical coordinator for a large pharmacy chain for 5 years. I'd be remiss if I didn't mention the fact that Dr. Lyons also has a best-selling devotional. This is just for you to sign on to it. And it is with Amazon called God in 30 Seconds. On our panel also this morning, we have Dr. Bruce Randolph. We're so glad Dr. Randolph is a part of this panel. Dr. Randolph received his Doctor of Medicine degree from the University of Florida's College of Medicine and has his public health degree from Johns Hopkins University School of Public Health. Dr. Lyons is currently licensed to practice medicine in Mississippi, Tennessee, Arkansas, and Oklahoma. He is currently the health officer for the Shelby County Health Department in Memphis, Tennessee. Then we'd also like to welcome Dr. Deepak. And Dr. Deepak graduated from Self Medical College in Mumbai, India with honors. She then went on to complete her radiology residency from King Edward Memorial Hospital in Mumbai and practiced as a radiologist. When she came to the United States, she completed her internal medicine residency at MedStar Harbor Hospital and her fellowship in pulmonary and critical care at the University of Maryland School of Medicine. Dr. Deepak is the site director for University of Maryland Summer and Winter Education Blocks for Pulmonary and Critical Care Fellows in Baltimore and DC area. And finally, we have Dr. Gloria Reeves. Dr. Reeves is a child and adolescent psychiatrist with specialized expertise in pediatric psychopharmacology, and obesity-related health issues among individuals with serious mental health. We welcome Dr. Reeves, and Dr. Reeves will actually kick us off. She's also a part of, because I just heard her say it, of Maryland. She's there in Maryland, the same place as Dr. Deepak. And I'm going to turn it over to Dr. Reeves so we can get this discussion started. And welcome everybody. And we'll be here taking notes as well. Dr. Reeves, if you would, please take it away.
Thank you so much, Pastor Young, and I'm very honored to join the group today for a conversation. So my name is Gloria Reeves. Please call me Gloria. I'm a physician and a psychiatrist over at University of Maryland. So I'm actually zooming in from Baltimore. So Baltimore, if you don't know, we call ourselves Charm City. And we're known for our crab cakes and our love of sports teams, the Ravens, the Orioles. But our barbecue is not as good as what I've had in Memphis before. I know that for sure. But we are here because it's a small world right now. We're all dealing with the same situation, and we're just here to put our heads together and learn from each other today. So I'm really deeply honored for the opportunity to come and present. So I'm just going to talk for about 10 minutes just to kind of introduce and give the lay of the land of how we're thinking about this presentation today, and so to set the expectations of what we're hoping to, folks will get out of it. So let me share my screen. Okay, all right. And everyone can see my screen okay? Can I get a thumbs up? Yeah, okay. So in presenting today, as a physician, I spend a lot of time talking to people about choices for health treatment. And I wanted to just set the stage that our goal today is not to convince anybody to make any specific types of decisions. What we really want to do is make sure that you have the information you need and the support you need to address barriers to even making a decision, as well as to follow through on it. So we're here to, again, to learn from each other, to share information, and to really support health decision making. So we have a lot of respect that people make decisions that are based on the best interest of themselves and their family members. But we also, as parents, we want to model for our children that we want to get good information from accurate sources to be able to make decisions that are in our best interests. So my piece of the talk, so I'm the only MD on the group who doesn't have a background in internal medicine, probably in intensive care and those sort of things. My background is in mental health. And the reason that's relevant to talk about today is we're all going through experience of anxiety, worries, challenges as a nation. And so I want to just share a little bit of information about how that might be impacting your decision-making process, and just some things to consider in how to get out of that feeling stuck or feeling overwhelmed. The other panelists are going to be providing a lot of information, kind of vaccine 101. I know people have been hearing a lot of information about vaccines, but it keeps changing pretty rapidly. So we want to make sure you have the most updated information about vaccines in terms of pros and cons as you're making your decision. And then I think all of us on the panel have personal experiences with vaccine decision-making. We'd be happy to share during the Q&A and discussion. And we want to make sure that we address any practical barriers to completing a vaccine if you opt for that choice. So just to give you an idea of my bias, so my perspective, besides being from the Baltimore area, just some other things to be aware of. So I do clinical research related to medication side effect issues. So to me, it's safety issues are really important when making a decision, and so happy to encourage any questions about safety issues that you might have or things you've heard from family members, friends, neighbors. As I mentioned before, I am a mental health provider, and so I've had a lot of experience to talk with patients generally about their anxiety about making a decision about vaccination, but also I've had experience supporting families who have a family member with special mental health needs get through the vaccine process. And then the last thing, and this is probably the most important, I'm a parent of a teenager, a 17-year-old. If I thought the pandemic was scary, but teaching her to drive was probably a little bit scarier than that. But I have a child who has a pretty bad fear of needles and shots. And so I'd be happy to share experience as a parent, what it's like to go through that process as well. Okay. I want to start out and just to highlight some information that probably things you know, but just to kind of reinforce what some of the challenges are with making decisions right now about health. And a big one is that we're all undergoing a lot of stress right now. So this is from information from a recent study, and they highlighted nationally, these are the different types of stressors that people are experiencing related to the pandemic. And oftentimes people are experiencing multiple stressors on this list at the same time. So some of the general categories are, a lot of people are going through relationship stress. So when we think about, reflect on our own lives, our lives of family members, friends, neighbors, people are going through family relationship challenges, feeling isolated, loss of people who are close to them. There's been a lot of illness, death, dying. And we've really restricted ourselves a lot in the last 2 years from traveling, seeing people that we care about, people that we love. There's also a lot of stressors people are experiencing in the financial realm. So people have experienced missed time from work. Maybe they've had to quarantine because somebody's been ill, or losing a job because business is not going well, difficulty paying rent, difficulty with getting adequate food for the family. So financial stressors, those can really be at the forefront and really causing a lot of anxiety. And then lastly, for those of us on the call who are parents, every parent I know has been through challenges with childcare issues in school. So it's been a bit of an unpredictable year in parenting and thinking about how to raise our child. So when we undergo a lot of extra stressors, a lot of pressures, a lot of anxiety, it's important to keep in mind that there are positive aspects of anxiety and really negative aspects of anxiety. The negative aspects are that most people, when their stress goes up and their coping strategies go down. So there were a period of time we were told to not even hug people that we cared about outside of our immediate bubble of our family that we're living with. So when stress goes up and coping options go down, people tend to have one of two responses. So they tend to either have the kind of where they get frozen, where they shut down. And so they have trouble making decisions, pushing ahead, or they start feeling a lot of distress. And so those can be really harmful for our health and wellness, but also to make a decision, it's really hard to concentrate, to think things through in a way you typically would and get the support you need to make decisions. On the positive end of things, there's not much positive about going through a pandemic, but we do know that stressful situations help focus us around two things. So one is around safety. So we're much more aware and attentive to safety concerns, and that's important because that's going to keep ourselves and our loved ones safe. And it's also this anxiety we're going through because of the pandemic often can be a motivator for action. So we want to try to balance out that feeling afraid, overwhelmed, and kind of shut down with kind of refocusing on how we can protect our families, encourage safety, and do the steps that we need to do to stay safe. So vaccine-related anxiety comes in a lot of forms. And I know that in the news, they use a lot of the term vaccine hesitant gets used a lot. I've been asking parents over the last month, is there a word you like better instead of vaccine hesitant? And I've heard a lot of options for that. Things like vaccine afraid, vaccine confused, vaccine worried. And so there are a lot of ways that anxiety can impact the decision-making process for vaccines. So first is, even being able to make a decision. So a lot of families that I speak with have a mistrust of vaccines generally. And if you have a child with special mental health needs, you might have worries that vaccines can make conditions that they have get worse, or you may have a general mistrust of health systems. How is this vaccine done so quickly and that sort of thing? So there may be mistrust of vaccines. Most people I talk to have difference of opinions from their trusted family members and friends. So it's hard to get a consensus from people that we normally turn to help make decisions. So making the decision is really difficult. And then if you decide to get the vaccine, then you have to deal with the issues that day, right? So dealing with missed time from work, any fears around getting a shot. So needle phobia is very common. It's been estimated up to 1 in 4 Americans have some degree of fear of getting shots because of fear of needles. So these are anxieties around the day of getting a vaccine. And then there's anxiety related to things in the future. So will the vaccine cause any long-term problems? Is it going to make me feel sick down the road? Am I going to miss time from work? So lots of different concerns. But just as a reminder, we know that when we are stuck in our decision-making process and we can't really make a determination either way, which way to go, we often as parents focus on the idea, well, I'm just going to delay. I'm just going to stop thinking about it for now, or I'm going to avoid making a decision, that sort of thing. So why is that a problem? So nationally, we know we have a problem not just about COVID vaccines, but childhood immunizations in general. So this very fancy graph, there's a lot of information on it, but the only thing you need to pay attention to are those blue lines that are going downhill. And that is when we had last spring around the pandemic shutdown, kids were not getting their routine immunizations. So this anxiety we're feeling, being shut down, overwhelmed, it doesn't just impact health decisions around the COVID vaccine, but it's also impacting families in following up with routine childhood immunizations. So that's why it's really our hope today is to really think of a process where you get the information you need and you can start to be proactive in making decisions and kind of breaking up that process if you would decide to get a vaccine into kind of smaller steps and smaller goals. So how to manage this anxiety around making health decisions? Well, first and foremost is we need to practice self-care. So as parents, we often tell parents that we work with, you can't pour from an empty cup, if you haven't heard that expression before. And that is, if you're feeling a lot of anxiety, reach out, because that anxiety might be getting to a point where it's causing a lot of distress. It's hard to push ahead with things you need to do, and it's hard to make decisions that you need to make for your family and for your well-being. So first and foremost, making sure that we're taking care of ourselves as the captain of the ship and our families. The second thing, which I think is very helpful for people, and I've been having a lot of discussions, and that is to focus your information sources. And by that, I mean, people are getting information from all different fronts, all different aspects of life about vaccines, on the news, on social media, from friends, family, from their doctors, from lots of different places. Narrow down those sources of information to folks who are trusted advisors and folks who can provide accurate, reputable information, because sometimes that information overload just incapacitates us further. The other thing is setting small goals. So if you're trying to think about something like a vaccine and consider it, maybe you need to start with just planning. How am I going to schedule it so I don't miss too much time from work? Maybe setting up an appointment with the doctor to get their opinions on the vaccine. So setting up small goals to get to the larger overall goal. And then figure out who your support team is. So if I lived in Memphis, I'm sure I'd be stopping by and visiting Pastor Young at least once a week, asking for support and help for challenges I'm going through. So think about who's on your support team to help you get through those small goals to get to your larger objective. Okay. So I'm going to stop sharing there, and just to say congratulations, you've met step 1, which is just coming to this program, getting information you need. But I want to encourage people to feel good about what you've done to get through this really challenging time, and that lets you know that anxiety has been a universal experience over the pandemic for all of us. So we want to support each other and help you be proactive in making decisions that you feel like are going to be in the best interest of you and your family. So I'm going to pause there, and I don't know if Michelle, if I should answer some questions first, or we're going to go through the talks first.
If you would, I think what we want to do now, we want to allow Dr. Deepak. So if you could introduce Dr. Deepak, I would appreciate it, and yes. Then we'll move on. So that's what we want to do. Thank you.
Okay. So we're shifting now from talking about just the general challenges with the decision-making process to now getting to that point where we're getting accurate, up-to-date information, what you need to make a decision. So I'm very pleased to turn over to my colleague at University of Maryland, Dr. Deepak, who's, if you're not feeling well, if you're sick, this is the kind of person you want to know because she's trained in so many areas. And I would think of her generally as the term I would use, an intensivist. So when someone's really sick, Dr. Deepak gets called. So Dr. Deepak, thanks so much for presenting today.
Thank you, Dr. Reeves. Thank you, Pastor Young, and thanks everyone. And I'm really honored to be speaking here. I am part of the team run by Dr. Niharika Khanna, who's a professor in family medicine. As Dr. Reeves said, I'm a lung doctor and I'm an ICU doctor. So definitely I've been in the trenches during this COVID pandemic. And I have a lot of information, and I'm going to try to break down some of the real cluster slides for you so that you understand what is the situation right now. And I can talk to you about all of my anecdotal experiences working in the ICU, taking care of sick COVID patients. So this is our entire team, and Dr. Reeves is part of Dr. Khanna's team. But this was our first outing ever in the post-COVID pandemic. And this was just a few weeks back, we met outside. So just told, as Dr. Reeves said, personal care. That's what we did here. So how you're getting the information is something like this, right? Like this is a very nice effort done by Dr. Khanna's group, and they put out dashboards like this. But this is the kind of information that is coming to us. So what is so different about this pandemic versus any other pandemic or any other vaccines is the information coming to us is coming in this cluster form, so many different graphs. And it is so difficult for us to understand what do we concentrate on. So let me try to break it up a little bit for you. So I'm going to tell you a little bit about the vaccinations and what is happening to the vaccinations in the entire United States based on race and ethnicity. And it is whether you've received one dose or you've received both the doses. And you can clearly see that unfortunately, it is not the minority populations all the time who are getting the vaccines. Rather, this is happening more in the privileged population, and the patients and the people who are struggling, who are in the minority populations, are getting stuck with a lot of fake news. My favorite word during this entire time has been fake news. And we have been hit by fake news very, very badly. I know because I'm from India, and everybody has been hit by fake news. And that's why we saw one of the most horrid COVID surges there recently. But that's the same thing that's happening here. And I want you to only concentrate, look at this green line that tells you about the Black population. And that is the lowest rate of COVID vaccinations in the United States. So let us also concentrate on what is happening in the children, because earlier in the COVID pandemic, everyone was saying the children are not getting affected. This graph is basically talking about two childhood populations. The 0 to 4 is this light blue, and 5 to 18 is the dark blue. These are males, these are females, and this is in the state of Tennessee. These are the number of children, male children, who are getting affected, not only affected, dying of COVID. Dying of COVID. Children dying of COVID. You break it down then to the populations by race, and you see most of them are white, but the Black population is not that far behind. These are children dying of COVID. So let us be very clear on what's happening. The state of Tennessee put out their most recent profiling, where they talked about the number of cases, how much it has increased from the previous week. They talked about the number of deaths and how much that has increased per previous week. And look at the number of hospitalizations also. It is a lot. It is a lot. This is a very nice graph. I don't want you all to concentrate. It's very disturbing to look at the whole graph and the colors and everything. For those of you who are colorblind, I apologize. Here is the problem. Earlier in the pandemic, the people in red, that is 70 plus years, they were getting the most affected, okay? Now, what are we seeing? Now we are seeing less than 18, 18 to 39, and the 40 to 69. That is the group which has taken over. This is disturbing, especially look at the 18 to 39 and the less than 18 group. This is very disturbing. This is the state of Tennessee and the different cities. And this graph here tells you about the number of COVID cases. And as you can see, this is for the week of the 13th of August to the 19th of August. And the areas which had high 750 or more are in the darker colors, and Memphis falls in the 550 to 749. By the way, I did brush up on my geography of Tennessee before I started this talk because I was not familiar with the different counties and different cities where it was, having only visited parts of Tennessee. Here is also a map of the vaccinations by the different parts of Tennessee. And you can see Memphis is here, where you fall in the 40 to 49% population. So what you need to know is where you're vaccinated and where the cases are. And as you can see, the higher cases are not in the areas which have high vaccination. It's just the opposite. So the lower the vaccination rate, the higher the number of cases. I am trying to, again, so this is again the state of Tennessee reporting. They are talking about the number of people vaccinated, and this is by age, and this is by race. And you can see here that the number of children who are vaccinated between 16 to 20 is only 5%. And the adults between, young adults between 21 to 30 is only 11.7%. And same with the group of 12 to 15, it's 3.2%. In terms of the percentage of vaccination against the, again, the Black or the African American population is lagging behind. This is a very good data. And why do we care? Because before the Delta variant, there were things which were different. This COVID pandemic is not stationary. It has not remained the same throughout the time. From the time I have started, you won't believe the number of papers that have come out on COVID, and every day there is new information on COVID. So this keeps on varying day by day, hour by hour sometimes. So this tells you, this is a graph which tells you that currently throughout the US, the Delta variant is here to stay, and it is the predominant variant. So what's happening in the state of Tennessee? So the Delta variant is this orange, darker orange, and red. The Delta variant is what is seen in region 4, which includes Tennessee, Alabama, Mississippi, etc. And you can see Delta variant is 98% of the cases. Why is this variant important? Because it spreads much faster, it causes much more serious illness, and it's affecting kids. This is a graph which tells you how much more disproportionately the 18 to 24 and the 12 to 17 are getting affected now. So I give you all kinds of bad news till now, but no, there is good news. Do you know the day the Pfizer vaccine was approved, within 3 days, we as doctors, as ICU doctors, were scrambling. We were calling people, we were putting our names on lists because we really wanted to get that vaccine. I got my vaccine on the first dose on 17th of December 2020. And my God, I posted on Facebook, on Instagram, on every social media, and I'm not a usual social media person because it was the ray of sunshine in this devastating pandemic. So the good news is we have 3 vaccines which were authorized under emergency authorization use. But guess what? We have even better news. We have a vaccine that has been approved just 3 days ago for ages 15 and above. And this is exciting. This is so exciting. This shows modern medicine at its best, getting a vaccine out, getting it prepared, getting it through all this. This is the expertise of modern medicine. There are a lot of ingredients, and I don't want you all to sit down, and I'm not going to break down all this. I want to tell you the ingredients in these vaccines do not contain metal detectors, do not contain tracking devices, they don't contain aluminum, and they don't contain heavy metals. So let us be very clear in what goes inside these vaccines. It is not what the fake news would like us to believe. Vaccines are definitely effective for the Delta variant. They are effective in preventing symptomatic infection and 96% effective in preventing hospitalization. And this is for the Pfizer data. Are there breakthrough infections? There are. And that's why there is the booster shot, which is coming up. And I'm going to show it to you in the next few slides, because they have noticed with some of these mRNA vaccines that as you go 8 months beyond, you may need a booster shot. So that is again new data which has just come up. So everyone's talking about vaccines are killing you. Vaccines, you get a vaccine and you get your heart muscles turned to mush and you die. And this is the kind of news that is coming through. But you know what? It is not true. It is very rare. And when it occurred in less than 30 years old after the second dose within a few days. But hot off the press yesterday, we have data which was just published in New England Journal of Medicine, which as most of us know in the medical community is one of the most prestigious journals to publish data. Now, this is the study conducted by Israel, because Israel did only Pfizer vaccine. They had a very clear rollout of the vaccine, and they looked at what happens in terms of all kinds of complications if you got the SARS-CoV-2 infection or you got COVID-19, that is in orange, or you got the vaccination, which is in blue. What are we seeing? We are seeing overwhelmingly that your kidneys fail if you get SARS-CoV-2 infection. You get heart irregular rhythms if you get SARS-CoV-2 infection. You get clots in your veins with SARS-CoV-2 infection. You get heart attack with SARS-CoV-2 infection. You get bad heart muscle involvement with SARS-CoV-2 infection. You get clots in your lung with SARS-CoV-2 infection. The only thing that was different was that you had enlarged lymph glands near the site of vaccination, and that was the only thing that happened with the vaccination. And if people have got diseases like mono and other things like croup, you will notice that you get enlarged lymph glands. So enlarged lymph glands just means that there is inflammation and the body senses it, and the body is revving up its immune response. With the Janssen vaccine, there was talk about the fact that your platelet count, which is your clotting cells in the body, come down and you get clots. But again, it is very rare. It is 7 per million, or if you're older than 50.9 per million. And again, the Guillain-Barré syndrome that they talk about, which basically means that certain people, after they get certain vaccines, and this has been talked about in other vaccines too, where they can get their muscles, which become really weak, including their breathing muscles. That was 8 cases per million doses. And that has been shown to happen in other vaccines. What is happening with the post-COVID conditions? I've been reading up a lot of data on this, and I'm actually seeing a lot of these patients who are coming to my clinic. The problem is that even if you are not getting sick, like I had a 23-year-old who got an asymptomatic COVID infection, was just found to be positive with COVID, had no problems at that time, is coming to me 3 months later. She can barely climb up a flight of stairs. She says, I feel like I'm older than my grandmother. I'm not able to climb up stairs. I get short of breath when I move around. And her X-ray at the time of the COVID infection was normal. And now when I did the CAT scan, there is a lot of scarring. So this infection can cause a lot more problems than what we know. We have not seen the length and breadth of what happens after you get COVID, because it's such a new infection. We are in the history of a new disease. We will not know all about the disease till a long time. There was a recent published data on children who got very mild COVID. These are teenagers who were in school. And guess what? They are not able to concentrate. They cannot remember things. They have brain fog. And several of my patients who I've seen in clinic have complained the same thing. So this is not about dying of COVID, getting lung injury with COVID. Even if you just get a mild infection or turn positive with COVID, these things can happen. So this is pretty scary, because there is just data that came out today that 3.6% of patients who ever were positive with COVID are going to have a lot of shortness of breath, and we don't know how long it's going to remain, but it has remained at least for 8 months. So how do we combat this, right? We need high vaccination. We need low community spread. The low community spread can only occur with social distancing, wearing masks, and trying to get the vaccine. And all this together is what is going to help us come out of this pandemic, come out to some kind of normalcy where we can meet each other again instead of talking to each other virtually like this. The HHS just came out with the guidance that they are going to offer booster shots for all Americans beginning week of September 20th and starting 8 months after the person's second dose. And these are for people who got either the Pfizer vaccine or the Moderna vaccine. Mine is going to be due next month, and I'm so waiting for it.
But if they want to do it, it's private, like the family thing.
Last but the least, you know, we doctors, we really want to help. Call your local doctor, call your family doctor, call the person who you are comfortable with. Go and see them, go and talk to them. Please don't believe the tweets you're seeing, the fake news you're seeing. Anybody can Photoshop anything. You won't believe that University of Maryland was Photoshopped as University of Facebook. And similarly, something similar like that happened in WhatsApp, where University of WhatsApp was under University of Maryland logo. So people do strange things in today's social media. And unfortunately, go to your doctors. We went to school for this. Go to your pharmacists, go to your nurses, go to all the healthcare workers who are seeing this, who know about it. Go to your pastors who are learning about it and who are helping you. Go to them. Please don't rely on the fake news. And that's all I got. Happy to take any more questions later.
Wow, that's all you can say about that presentation is wow. Thank you both. I mean, that was, we're sitting here going, wow. Great information. And we will get to the Q&A. But right now, if you guys would, we want to introduce our county's best, and that would be our health officer for Shelby County, and that is Dr. Randolph, Dr. Bruce Randolph, also a minister. And we're just so glad that he took the time to join us today. We're going to start with Dr. Randolph. And after Dr. Randolph, you're both ministers, you and Dr. Lyons. So you're ministers, and you both do what you do so well. And we're gonna hear you and Dr. Lyons. Dr. Lyons is a mobile vaccination. It's the best thing I've ever seen. I'm going to turn it on to you, Dr. Randolph. Thank you both.
I want to just say, I guess it's still morning, not quite 12 yet, at least here. But I want to thank Pastor Diane and Pastor William Young for the opportunity to participate in this event and this program. I want to thank Dr. Reeves and Deepak for this complete overview of what we're dealing with and the data. I view my role as sort of breaking it down to the local level. Exactly what is the situation currently as we're reporting hot off the press today at our press conference. Matter of fact, you'll get it before even it's released on the press conference at noon. And that is when we look at this pandemic that's been going on, we have experienced now 122,041 cases. We're reporting today 535 new cases. Our 7-day average for new cases is currently 744. And our 7-day average test positivity is 21%. It's increasing from where it was. Our reproductive rate, how often is this being transmitted to others, has decreased to 1.13%. One while it was as high as 1.4. Our active cases now is 8,517 active cases. Now, of those 8,517 active cases, 2,767 of those are pediatric cases, which means that 32.5% of our active cases are in the pediatric population, which we define as ages 0 to 17. Actually, we're reporting that we have 203 pediatric cases today. So that age group 0 to 17 represents the highest percent of the active cases among all the age groups that we monitor. When we look at the total of deaths that have occurred among the pediatric population during this pandemic, we had 1,833. We've had, of the pediatric cases, we've had 18,212 pediatric cases, but the active cases, as I stated, is actually currently 2,776. We've had a total of 1,833 deaths total, but only 3 pediatric deaths that we've had as a result of COVID. The other thing I want to just point out is that since we started Vaccinated, we've had 930 deaths, period, here in Shelby County. But over the past 14 days, we've experienced 48 deaths. In terms of hospitalizations, we're currently reporting that we have a total of 665 cases of COVID. Of those 665 cases, 887 of those are in the acute care unit and 178 are in the ICU. We have 28 pediatric cases that's hospitalized. And of that 28, 21 are in the intensive care unit and 7 are in the ICU. Here in Shelby County, 98% of the cases are due to the Delta variant. We've had some breakthrough cases. We estimate that approximately now 6.8% of our cases are due to breakthrough. We also know that here in Shelby County, only 38% of the population is vaccinated, fully vaccinated. Of the eligible population, ages 12 and older, it's about 46%. I think it's 46.5% of the eligible population that's vaccinated. So as you can see, we have a long ways to go. We set a goal of trying to vaccinate at least 70% of our population, which would have been about 700,000 people. And that goal was to at least give 1 dose. And we're currently at about 65% of that goal. So we still have a long ways to go. The only way that we will get out of this pandemic is through the vaccination. We have recently, as you well may be aware, instituted a countywide mask mandate that requires the use of masks indoors, whether you're vaccinated or not, in certain areas. There are some areas that allow for an exemption. We've mandated in schools, though the governor issued an executive order that allows parents to opt out. But we are really encouraging and emphasizing to the population that they must take personal and individual responsibility. We've laid out the preventive measures. There's a vaccine that is available, and that it's up to us as individuals to take full advantage of these tools that are available. And that's the only way that we're going to really be able to get a handle on this pandemic here in Shelby County. With that, I'm going to stop and allow time for specific questions that people may have. And again, I thank Pastors Young for this opportunity.
Dr. Randolph, I know you've got a press conference. Are you going to be able to stay? And so we can, because we want to do Q&A at the end.
Yes, I'm gonna stay. I'm not scheduled to be on the press.
You're not the star today. Good job. Good job. Thank you so much. We're gonna turn it to Dr. Lyons, and we're gonna take Q&A at the end. Everybody, you can start putting your questions in the chat. Our panel will remain. Thank you, Dr. Lyons. There you go.
Good afternoon, everyone. Dr. Randolph, before you go on mute, did you happen to have the hospital number, hospital bed numbers available, the new ones available?
No, but you could actually, and I should have mentioned this to everyone, I don't have it with me in terms of the availability of the beds. I know that, but you can find it at shelbytnhealth.com/COVID-19.
I just wanted to make sure, the last I heard, we were down to, we're at about 96, 98% full.
Yeah,
And I think
right.
we should probably either
Yeah, it's
worse
somewhere
than that,
down
probably
there.
no better than that now. So just wanted to check on that before we got started. If you guys could go ahead and before we get started, show the video that I sent in, and we're going to watch that, and then we're going to talk about something right quick.
I run a channel on YouTube that specializes in super slow motion footage. And I've actually shot something for you so we can watch it together if you've got the clip ready. So this is footage I shot. It's 1,000 frames a second, which is roughly 40 times slower than how it appeared in real time. And I just counted from 1 to 4. Those are the numbers you can see at the bottom of the screen. And I was blown away at the amount of particles that came out of my mouth. Not only from the spit, sort of at the beginning of each word, but after I'm done with the word, particularly the word for, you can see like a fine mist come out of my mouth. And that was actually really surprising that I could see that with the naked eye. The particles that are so light that they don't fall. And I wasn't even shouting that loud. That was like a medium volume of talking there.
Yeah, I think what you've just shown is a you know, graphically beautiful demonstration of the importance of wearing masks and face coverings, because as the film shows now, you're saying the same thing, 1, 2, 3, 4,
Right.
and very little is coming out from the mask. So, you know, we say, and I think graphic demonstrations like you've just shown now really solidify that. One of the reasons why it's so important to wear a face covering is that we know now that about 40 to 45% of the people who are infected don't have any symptoms.
Okay, and that number is probably going up with Delta variant, because a lot of times Delta variant folks aren't showing up with symptoms at all. That was before Delta variant became the predominant variant that was out there. I show that video to almost every school that I go to, and almost every group that I go in and educate their business, whether it be you know, the Hershey's that I'm dealing with. They have about 4 shifts. I do this with every shift to show them what happens when we're not wearing face coverings from just talking. Everybody talks about sneezing and coughing and all those things. No, just from talking, we're still putting all these particulates out. And it really helps drive home the point that we need face coverings. But it also helps me lead into the discussion about, now that we have a variant, it was bad enough when we had the wild virus, but now that we have a Delta variant that puts out 1,200 times more than the original variant, than the original wild virus puts out into the air, as far as the amount of viruses going out there, the viral load that we have even in the body. This is not the time to take off masks. I'm not political at all. I just want you to understand that. I am about public health and safety and helping people. So if you feel like this is going to be political, don't. I'm just telling you, put a mask on, okay? Put a mask on and let's get vaccinated. Why do we want to get vaccinated? It's everything that you just heard all of these doctors and learned individuals give you information on. Coronavirus is ravaging our community. When we talk about the United States, Tennessee, and Shelby County, we are all under attack, but we're under particular attack in this area. We have very few hospital beds left. We have a case positivity rate over 21% now. It was 20% a day or two ago. Now we're over 21%. It's not going anywhere. It's not going anywhere because we are not vaccinated. We are not wearing masks. We're not doing the things necessary to keep us safe. I'm going to give you all some information, and Dr. Randolph particularly, I want you to listen, because I'm out here in the streets every day. I'm in the schools, I'm on the corners, I'm at the churches, I am in the community events when they have a block event and they're just giving away food. I'm there giving vaccination and testing every single day. And what we learn on the ground is different than what you see a lot of times from these charts. Matter of fact, all the time is different. Today, even one particular thing I want you all to hear and understand, please hear my heart. These kids are smarter than all of us, okay? They are right now have a pact, a COVID pact at one of the affluent schools here in Memphis, where they're saying we're going to give each other COVID so we can go back home and have virtual learning. This is not hearsay. This is happening. I had, even before I could even check it myself, I had a parent call me from that school and tell me my son was one of them that was actually doing this, taking his mask off, and he was gonna, drink out the same cup as everybody else so they can go back to virtual. And she said, what is going on? So we have some things that are happening that are not caught by numbers. We have to deal with the reality of what is going on in our schools and our communities. And I'm starting with the kids because our kids are our jewels. If we don't care enough about ourselves to do anything, we usually care enough about our kids to do the best things. And our kids are our jewels. They're the arrows that God gives us to launch into the future and be all that they can be and help our world be better. Well, our kids are under attack. If we don't want to pick up and fight for our kids, and I don't really know what else we can do. But right now, our kids are going through an attack in these schools that is beyond belief. We have parents, again, I'm in the schools vaccinated. I have about 9 schools I go to and educate and vaccinate on a weekly basis. They have me come on a weekly basis. We have kids right now coming to school where parents have not waited to see what their coronavirus testing results were. We have parents showing up who don't know what their testing results are, but they showed up to school and dropped their child off anyway. They walked their child all the way during orientation week for the elementary, walked them all the way to the teacher's classroom anyway. Then they find out that, oh, I am positive. Oh, little Timmy is positive. And now you're coming back to pick him up. Or now you're calling and telling the teacher, well, I was in your class today and I found out that I did have coronavirus. These are the types of things that are happening on a consistent basis. Am I telling you this to shock and scare you? You better believe I am. I really want you to understand what is going on. It is not what you see on TV. This is the ground game. We had the point in time where we could have just done the pop-ups and the large venues where we got people coming in and they drive through and get vaccinated. That's just like with selling anything. You have your early adopters. Now we're in the part of the game where you have to get out here, you have to educate, you have to drive home the points and talk to people one-on-one to get them to understand this is why it's important to wear a mask. This is why it's important to get vaccinated. This is what we can accomplish if we do that. If we're not having those types of conversations in each of our own social circles and cultural circles, then we're not going to get what we need to have happen with this pandemic. It's going to be 2024 and we're still talking about this. We're already into 2022. We might as well cancel 2021. 2022 is where we're going to have some hope, because right now, 2021, we're wrapping it up, still infected at a high rate. So we need to make sure that we're having these conversations. I can give you story after story. It broke my heart on Monday to have one of my patients come in. His wife already was pregnant and he's 28 years old. And she caught coronavirus because she didn't listen to her OBGYN and ACOG telling her to go ahead and get vaccinated. It's okay in your first, second, or third trimester. But no, she didn't listen and she got coronavirus. Now she can't walk across the room. He's taking care of her for weeks. He said, I think I should come in and get tested. Yes, go ahead and come in and get tested. We tested him. He's positive now. That means now he can't go to work. That means that she's now in the 9th month. She's entering the 9th month, which, you know, for African Americans, we tend to have a lot of preemies. So if she has that baby this week, he can't touch the baby. She can't touch the baby. They have to watch the baby on an iPad. That's not what we want. That's not what we should want for any of our families and children that are out here. But these are the real things that are happening that we're not discussing. We have to talk about these things so that people will understand when we have the opportunity. I thank Dr. Young and Pastor Young, Bishop Young, Dr. Young for being out here and being a voice to help get some of these stories out, and all of this information that was here today is great. But as we continue to do this, I really just am asking each of you that are listening today, and then especially the panelists, as you are talking to folks, please tell them some of the real things that are happening out there as you come across them. I come across them every day, and if you all had time, I could tell you some things that you probably start pulling your hair out and not believing. But yes, there are some things that happen every day, like these kids today with this COVID pact. I mean, how many more schools are we going to see that with? You know, this all got spreaded on TikTok. You know, with them doing that on TikTok, and they showed up to school yesterday and today saying that this is what we're going to do. It's time for us to be very, very poignant and real about how we're going to address this. I'm going to leave time so everybody gets questions and everything, but I want to drive home that point because where we are now is about our kids, and they're the fastest growing group getting it, and they're going to be the fastest spreaders of it because you really don't see a lot of symptoms in kids for most of these kids that are catching it. So that means that they're just running around everywhere spreading this, and they're coming into a closed environment for 7 to 8 hours a day, and they're doing this, and we have to do something. And the thing to do is vaccinate and mask up.
My goodness, powerful from both. Oh, wow, what an awesome panel we got today. We're gonna take all your questions. I see many questions that's hopping in our chat, and we're gonna take those questions and address them shortly. Dr. Lyons, that was incredible, and that information was actually something that will make us all tremble. Now we're going to have a wonderful guest, Priscilla Davis, Dr. Davis, and she's going to come. She wants to share a little bit of something that may help us with our decision making, and then as well as help us to help others, because this is about our families today. This is about us getting this information. Dr. Davis, welcome. No, you're not in Memphis now, but welcome home for a moment. Thank you.
I'd like to talk about, I guess this will be a blast from the past. Dr. Young, William Young, Bishop Young, and I know about how old that would be. But I'm going to go back to when I was 9 years old. I was visiting my aunt in Mississippi during the summer, and I became ill, and she sent me home. My mother said overnight she couldn't get my fever down, so she took me to the doctor the very next day. I felt really, really bad. I had a bad headache, and my back was really hurting. But, you know, I was mobile. My limbs were okay. After the doctor examined me, he told me to hold my arms up. And I held my arms up, and that right arm fell down. That right leg became really weak. He said, "You have polio." Now, I'm sure when I asked this question, probably nobody in the audience here has had polio, because this was when I was 9 years old, and it was before the vaccine. They had a hospital here in Memphis on Jefferson called the Jefferson Pavilion. I was sent to Jefferson Pavilion. I was quarantined for 90 days. That means I could not see my parents, anybody, you know, just up close. I'd go to the window, they'd stand outside the window, and the first few weeks I was up on the second floor. And of course, I'm sure that was really good, hollering down there. And then after a while, I moved down to the first floor. And down at the first floor, you know, I could come out like on the balcony, and we could talk to each other a little bit better then. While I was in the hospital, I saw lots of people in the iron lung. And then I guess to prevent them from having cold sores, they put them in a rocking bed. Well, you know, I wasn't that affected, but that rocking bed seemed really exciting. So sometimes I'd hop up on that rocking bed. They took me down. Okay, so after being there for a while, for the 90 days, I did get better, but I still had problems with my arm, my right arm and my right side. If I wanted to move my right arm, I had to pick it up with my left arm. They had a special chair built for me with a little sling on it to hold my arm. And I was advised to start using my left arm because I would not be able to use my right arm again. And after being dismissed, I needed physical therapy. We got physical therapy in the hospital. But now this was back around 1957, something like that. There were no hospitals, no places here in Memphis where I could get physical therapy. Now, St. Joseph, which is now St. Jude, and I think my mother probably kind of worried them into this because I didn't see anybody else looking like me there but us. They told us we could come over there to the physical therapy and watch them do therapy with white kids. And then we'd go home and practice. And we didn't have all the stuff they had. We had bricks and sticks and whatever. My mom, my dad, grandparents, everybody took turns working with me. And I believe in prayer. I prayed, and I prayed to the Lord to heal me, and the Lord healed me. Now, he didn't heal me overnight. I hear Pastor Diane say, we think about God as being a magician. Not a magician, but a healer. Okay, then after I was in the third grade, I was going to the fourth grade. So by the time I got back to the fourth grade, about the middle of the fall, the vaccine came out. That was the one where they had a little vaccine on the sugar cube. And I don't know if that was saving us salt, because there were two vaccines that came out. One, later on, they gave you injections. I did not have to have that because I already had polio. And now, by the time I was in a junior high, in high school, Bishop Young would know, I was active with drill team. And as Miss Pope used to say, we were out there hopping and flopping. So all of the paresis and all the things that I had at that time, I was healed. And people who knew me readily, hurriedly got the vaccine. So I'm here to say that the vaccine does work. And again, I'd like to know how many people out there have had polio. Probably none. And then another one, chicken pox. Probably those people around my age had chicken pox. I have a daughter who's now 37. I can't remember how old she was, but the older daughter had chicken pox. But we went for her regular pediatric visit, and our physician told us they have just come out with a vaccine for chicken pox. So insurance is not covering it now. It'll be $50 if you want it. I said, I would pay $50 for my worst enemy to have that vaccine for chicken pox. And then I know probably nobody out there in the audience over what? Well, I guess about 30 something, had chicken pox, because we had chicken pox at that age. That's my testimony.
In other words, you're saying get the vaccination. Have you already had your vaccine for COVID-19?
February 23rd was the second vaccine.
So
line when they were all around the F.A.C.E.S, that building, Pipkin building.
You were one of the first ones in the line.
I was.
Thank you. And that's because you had experience and you knew what a condition, what it could do to your life, change your life.
Teething is terrible.
I hear you.
At 9 years old.
Wow. Thank you so much for sharing, and thank you for being here and a part of this panel. Everybody, if we could bring this panel back, the whole panel, I don't know if anybody can, if we were in church, we'd clap because this panel has been awesome. And I'm sure we have questions. If you would, panel, if you turn your cameras back on so they can see you. I know we've got some questions in our Dr. Lyons. I see one for you here. Can you talk a little bit more about the COVID pack that's taking place in our schools right now?
Yes. So what's come into us is that it started with again, it was in one of our more affluent communities with one of their middle schools. And so the middle school kids were saying, hey, let's go ahead, spread it around, get it if you can, so we can go ahead and start virtual school back. They're all wanting to go back to virtual school. And it's seeming like it's kind of going to spread up the chain, and some high schoolers are saying the same thing and things like that. That part of it is more rumor now than anything. But if we get ahead of this thing and make sure we're having parents talk to their kids, because a woman that I talked to this morning, that's what she did. She kind of snatched her son up and said, hey, we're not going to be having any of this. You keep that mask on. You already got your first vaccination. You'll be going back to Dr. Lyons to get your second one next week. So she kind of snatched him up and got a hold of him, but she wanted to let me know that this was going on. I just heard it from someone else as well. So that seems to be what it is again, they spread all this stuff around on TikTok and their Snapchats and things like that. So it's hard to catch it unless you're on your child's information, like we are with our 16-year-old. we're on her stuff. But you know, it's going to be really hard to catch things like this. But if, as a parent, you're having those conversations and you're asking your child about it, it may not even be your child, but they may have heard other children talking about this, then you can get it on to the administrators and then the county officials and whomever else needs to know, so that we can say, hey, let's stop this. You know, that's something I need to see blasted out on, you know, the evening news. Hey, you all, let's not do this. This is not anything to play with. I had one other mother who had an elementary child that came in last week, and she was faking symptoms because she wanted to be at home. And so after getting swabbed, she didn't like that anymore. So I don't think she'll be faking anymore.
Wow. Wow. Good answer. I think I see a question here for Dr. Deepak. I think this is for her, or Dr. Randolph can take it. How soon will we be able to get that booster? Do we have a sense of timing? And is the time for the first shot, is the time from the, what is the time from the first shot or the second shot? What's the timing from the second shot? Because do you need to have both of your shots before you get the booster? I'm going to start with Dr. Deepak, and then Dr. Randolph, if he want to jump in and add to it.
Yeah, thank you for that question. So yes, so you need to have gotten both the shots of the Moderna or the Pfizer vaccine, and it needs to be 8 months after your second shot. Again, 8 months after your second shot, not after the first shot. It has to be after the second shot, because there is a different variation in the booster, and they are including the spike proteins, they're including the things against the Delta variant, and we don't know what will happen if you get it after the first shot. So the data is showing it's only after the second shot, and it's 8 months after the second shot.
Dr. Randolph, do you have a clue about when we will hear in Shelby County? Will it start on September 20th here? Thank you, Dr. Deepak.
Well, that's the goal to start it. There's some issues, though, that really we're going to have to work out as a society. And that is, we're going to have possibly a great demand for that third shot, but we don't have the infrastructure to administer it, because we won't have the mass vaccination sites that we had initially, where people drove through and what have you. All of those have been taken down, have been closed. So we have to heavily depend on primary care physicians and other community partners to administer this third shot. As it is now, a lot of folks will kind of look toward the health department to be the one who provides this third shot. And very few health departments are going to have the capacity to vaccinate that many people. You know, so we're talking about Shelby County. We've vaccinated in Shelby County 362,211 people so far. Granted, all of them didn't receive Pfizer, but a significant number did. So and that timing is going to be very important. You know, the 8 months period, and I imagine that there's some debate about that, because some have even advocated perhaps 6 months. And so there's going to be some debate on should it be 6, 8. The other thing is, the challenge is hospitals played a major role in administering the vaccine initially. They are overrun and inundated with cases, so they won't have the capacity to administer it either. So yeah, September 20th is our goal to start, but we're going to have some challenges in terms of getting it up and going.
Great answer, and we appreciate it very much. I'm trying to be sure I get all these questions in. Dr. Lyons, I know I mentioned that you do mobile activity. I have a question coming from Mississippi. I'm a business owner in Mississippi, and I need to know how or what I need to do to get you to come and set up a vaccination in South Haven.
Right. I get that question from Mississippi, especially North Mississippi, and over here in West Memphis, Arkansas, almost daily. We can come and do the educational piece, but as far as how we are actually, we're a business. So as far as how we're actually able to bill the COVID relief fund and also the insurances who are mandated to pay for the vaccinations, they're requiring us to go through and be credentialed by them. So in Mississippi and Arkansas, they're not credentialing a Tennessee business. So that is the part where we cannot administer the vaccinations over there. I will do the education piece for you. I always do the education pieces for anyone who asks me to come out, because I'm a small business. I don't care if you go to Walgreens, Kroger, wherever and get vaccinated, just go get vaccinated. So I'll do the education piece, and hopefully they'll be able to get another provider to come in and do that for you all. Dr. Randolph, we have a ground game. If you all are able to help us get out here in the communities, we can get it done. That's how we're going to be able to get most of Memphis and any of these other areas that you all are in, the other panelists. You have to get a ground game going, and you're going to have to use some people like myself in your areas to go ahead, and we have all these COVID relief dollars and everything else out here. Let's get the teams together. Let's get out here and get folks vaccinated with people who are willing to spend the time. There's no way the health departments or anyone else can spend the kind of time that I spend talking to people and getting them to get vaccinated. That's not what you're built for, and that's not what you're supposed to be built for. So let's utilize the providers.
Excellent, excellent. Thank you, and I hope this collaborative effort begins right are there?
Pastor Young, yes. With a quick comment about Mississippi. So I just wanted to mention, Dr. Deepak mentioned that some of our work to do outreach and support people getting the vaccines is funded by your taxpayer dollar, because we have a grant through a federal agency called HRSA, H-R-S-A. And I just want to mention that there is a organization that is funded from HRSA to specifically target Mississippi. And I could put the information in the chat. I don't know if this is an organization familiar to anybody, but it's called the Delta Health Alliance Incorporated. So I'd encourage the person who put in the chat that you have a business in Mississippi to reach out to them, because they may have special resources specifically to support through this grant funding.
Excellent. Great information. Thank you so much. That's why we're all here. Teachers are, I guess we want to ask the panel, and somebody can jump in. Are there any efforts to ensure that our teachers are safe and vaccinated? Teachers want to know, are there, I mean, other than the mask, and if the children do have the PAC that Dr. Lyons was talking about, how can teachers help break that up? Dr. Deepak, you look like you want to jump in there, and if you do, go right ahead.
So I can tell you what, I'm on the State of Maryland Immunization Commission, and we did talk about this a little bit. And what we talked about was teachers and sports coaches in school being the people to kind of discuss with the students on how important it is to wear the mask, to kind of debunk some of these myths that they have, like the COVID pact and the fact that, you know, children don't get sick with COVID and these kind of things. And in the state of Maryland, the teachers are required to be vaccinated, and they are also getting weekly testing. So that is what they're trying to do. Now, having said all this, children are children, and children are phenomenal. I have a 25-year-old. I don't have a teenager anymore, thank God. but my 25-year-old is on weird social media, which I've not even heard of. And good Lord, they can spread information to each other much faster than us. So I think the only way we can do it is to try to get on some of these social media, try to put some good information out there to contest this fake news that is going on, and try to talk to them in their own terms. And that's why I was thinking we were discussing about sport coaches and people who they look up to as being the ones who are educating them, because they don't really listen to parents.
Thank you, Dr. DePeck. Great answer.
Dr. Young, one thing about the sports coaches, that's one of the things that we're doing right now. So for all you teachers who are out there, you are kind of as important as the sports coach. The sports coach is only going to be able to deal with that team, but we're telling them, look, just tell your team. We know you can't mandate it because you're a public institution, but tell your team, I want you vaccinated. Coaches vaccinated, I want you all vaccinated too. Teachers, you all can do the same thing. Hey, I'm vaccinated, nothing happened to me. I would like for all you all to be vaccinated too. You can say what you want because that's your prerogative as a teacher to say what you want. You can't mandate anything for them, but you can tell them what you desire for them to be healthy. And that would be a good way to help combat that as well.
Thank you, Dr. Lyons. Dr. Randolph, here's a question. I don't even know if you'll know the answer, but I know you'll be able to feel around and help us out. There is a problem with COVID at the criminal justice complex. Extremely dangerous condition is what's being reported. And I mean, if this is true, then can you address, is there anything special being done at the criminal justice complex about the outbreak that's taking place there?
Well, first of all, I would say that the care of people who are incarcerated falls up under our responsibility at the health department. So there are cases, how much of an outbreak we would have to see, but we do know that there are cases. What we have done and what we'll continue to do is we have protocols in place where, for instance, when someone is arrested and going through intake, they are screened, they are quarantined for 14 days before they actually mix with the general population. If there's any indication that they may have symptoms or been exposed, they are tested. And if any of them developed symptoms while in their particular pod, they are tested, quarantined, treated. We actually have extended the vaccine. I myself conducted in-person interviews and demos and answered conversations. We had talks similar to this, answering questions that the individual detainees may have had. As a result of that effort, we end up vaccinating, I think, a total of 200 of the detainees, the incarcerated individuals. And so we monitor that situation very closely, make sure that people get the adequate care that they need. And so we will look even into this allegation that there's a major outbreak to see if it's any different than what we are already aware of. I mean, we've had cases. That's really to be expected whenever you have a congregate setting. You got people, it is difficult to socially distance. And though they may wear masks, still the whole issues of ventilation, closeness, etc., place individuals in a congregate setting, such as a correction facility, at higher risk. And then the general population.
Thank you. I'm glad that you're bringing these things up so we can be sure that we get an answer from the experts that are here. And Dr. Randolph, I think you have his word that he's going to check on and see what's happening there. Somebody is asking about the Johnson & Johnson. When will that booster be available?
So there's no data as yet on the Johnson & Johnson vaccine. When they came to the NIH talks a couple of days ago, they have not let out data as yet on what they're going to be doing. Remember, Johnson & Johnson was a single shot. So there is some talk about people getting a second shot of the Johnson & Johnson. There is no talk on the third shot at all for Johnson & Johnson. And the data is not available. And similarly, I was also asked a question on if there was an increase in the COVID vaccination rates after FDA approval, and it's too early and we haven't seen that data as yet. And is there going to be a decline in vaccine? I hate to use the word hesitancy, rather mistrust or confusion, if you will. I don't know. I honestly don't know, because I think that the game that is being played by social media in influencing people is profound, because as Dr. Davis said, she had polio, people saw her, they got the vaccine, and today we don't have polio, we don't have smallpox. 1980 was the last case of smallpox, and I have seen people ravaged by smallpox and polio in India, and India took longer to get rid of both of them. We never questioned whether we should do that. We don't question whether we should put our children in seat belts, because that's the right thing to do. But we do question whether we should take this vaccine. And I don't know why. I really don't know why. I'm unable to understand this as a doctor, as an ICU physician, whose job has been in these past year and a half or nearly 2 years to keep consoling families and tell them why their loved ones are dying, why a 33-year-old pregnant woman did not get the shot and she is dying and she's never going to see her child. And there are so many cases of this. And that is what we are dealing with as healthcare providers, as doctors.
My goodness, what a picture you painted there for us, and I see it vividly. I guess I need to ask a couple of questions, but I do want to remind everybody that we have a quick survey, very quick, and it's in the chat. If you would, after this session, if you would fill it out. But I do want to know from our, I guess, Dr. Lyons, Dr. Randolph can tell us locally. Well, everybody can tell us, will our primary care doctors have the booster shots available in the office?
Well, I just was on a call yesterday where it was announced that there are efforts to get third parties to play a role in making sure that the vaccine is available to primary care physicians. One of the problems especially has been just the difficulty it is in storing, transporting the vaccine. And early on, when there was a big concern about wastage, now they're coming up with ways where a primary care provider could get a small amount, and now that you can extend the period of time that it can remain in the refrigerator, it affords the opportunity for primary care providers to be able to offer it. That's the only way we're going to be able to do it. We must rely on the primary care providers to be able to offer the vaccine.
Wow. Now, Dr. Lyons, I guess, you will continue to do what you're doing, the mobile thing that you do. You will be continue to do that, right?
Yes, we are going to continue being mobile, going to every community. Every time we can get set up, you know, we have a handful of people now. So the more people we get, the more we can do. And then, of course, our standalone clinic that's here as well. They can always come visit us here.
All right. Peers. Some of the partners, I guess the partners, because we'll continue to do it at our clinic, and it sounds like it's going to be a little complicated, but I know we'll make it happen. Come listen to Dr. Randolph.
Yeah, we're going to make it happen.
Yes.
This is Memphis. This is 901, right?
That's right. Now we got it going on. Well, let me see. Is there a list of places where the mobile units will be? That is for you, Dr. Lyons. And dates. Do you have it on your website?
Right. You can go to www.shotrx901.com, and it's always listed our upcoming events on there. They usually update them once or twice a week, so you'll know where we're going that particular week when it's a large community event. The schools that we rotate through, we don't list them on there, but all of the schools send out blasts to their community, the family members and everything. So if you're in one of those areas where we are doing that, we're basically in the toughest hit areas. So that's going to be Hickory Hill, Whitehaven, Fraser. We have one charter school over there that we do. And then also, where else? There's one other place. I forgot the other one that we do. We have like 9 that we're doing, but we just check with the schools if you want to go to one of the schools to do your vaccinations as well, or just call us. You always call us 901-779-6500.
Okay, thank you so much. There's someone that wants a copy of the slides that you did, Dr. Deepak. Will they be made available?
I gave it to Michelle already as a PDF. So
you've already given it. Oh, you're awesome. Also, be sure that you fill those out. I want to thank those who you don't see, who are behind the scenes that partner with us. We want to thank Alliance. That's one of our wonderful partners. All of our agencies, the state of Tennessee, the Tennessee System of Care, SOCAT, University of Tennessee, and we have a new partner, and we want to get more information about the Tennessee Community Engagement Alliance Against COVID. There is a new agency, and we're going to get more information about that. Dr. Stewart is bringing me in the loop on that. So we want to be alert and aware. And if you have people, a family that you want to be sure everybody get their shot, let's have some more conversations. Let's do it. Please don't forget to fill out that survey. That helps us so much as we move forward to know what else you want. Any of the panelists need to give any final words that you want to share, to be sure everybody knows where we go from here. If anybody want to just give a one-liner, please do.
Yeah, I'll start it off because I got to go vaccinate a middle school right quickly. But hey, let's educate and vaccinate. That's it.
Thank you. Anybody else?
Yeah, just remember that vaccines work. They work. Prevention works. Prevention is any day better than cure, and God helps those who help themselves.
Thank you, Dr. Deepak. Anybody else? Jump in there right quick.
But one thing I want to say is definitely vaccination is the main way we're going to get out of this. If you're not vaccinated, or even if you're vaccinated, you should wear a mask, especially if you're indoors around people that you don't know their status. But the other thing that I want to say is that it's very important that you use personal individual responsibility. Just because something is open does not mean that you ought to go to it. Just because something is legally permissible does not mean that it's medically advisable. So if you know that you're not vaccinated, you know that you got some underlying medical issues, then you don't need to go to the festival that's taking place where there are going to be a lot of people. You should exercise some sound judgment and stay home.
I like that, Dr. Randolph. I like that. Don't put others in danger. I like that. Anybody else? Dr. Davis, did you want to jump in there?
Yes, get the vaccination. You don't want to go through I'm sure COVID is maybe a lot worse than polio. I don't know, but polio was hell.
Wow. Thank you so much. And Dr. Reeves.
I'd just say continue to be a friend to those in your life who are unvaccinated. There are 1,000 reasons why people don't get the vaccine. And even if you don't understand it, people are listening when you're talking, and you never know if what you're saying makes a difference.
Thank you. I think this has been incredible. We were not able to stream this live, but we will be posting it on our Facebook pages. The National Federation, they joined us in this time, National Federation of Families. They did an incredible job of putting everything together. They did all the work. They're still working in the back room to be sure that this is done. Thank you, Federation. I've sent a one email and they jumped in and say, hey, let's do this. And I think this was just super. I am going to go through this again because it was so wonderful. It will be posted on my page, and everybody else, please go. It will be, Michelle, posted on the National Federation of Families. Is that where we can pull it from? And please stream it on your page.
Yes, ma'am.
Okay, and tell others that this was a major black eye for fake news, Dr. Deepak. This was a black eye for it. God bless everybody. Thank you so much. Appreciate it. If you want to put some information in the chat for our speakers, it would be a wonderful thing. We're gonna let you post thank you or whatever you want to say just to them. Thank you all for doing that, and have a blessed rest of the day. God bless.